Okay, well, welcome everyone. Our first meeting without Jason leading it. Um, I did want to let you know just real quick, we do have a new board member. He had been invited to this meeting, but we didn't find that out till today, so it's kind of short notice. So he's also invited to the next work group meeting next week. And hopefully he'll be able to attend the next board meeting. It was Dr. Scott Mitchell from Huntington. So, but Jesse, I'll let you get started.
Sure. And I don't know if there's an agenda that floated around. I don't believe we did have one for the meeting. I'm traveling and had not put anything specific together. I know there was some talk at the last board meeting about discussing, I guess, diversion. I know we had 3 other topics that we had tried to move into these meetings, and then things kind of got sideways on the scheduling. So I don't know that I don't have a formal agenda to go through tonight, but if anyone wants to jump in and kind of have the discussion following up from the last board meeting, I think I'm happy to do that. Or to the extent anyone has any other thoughts, please jump in. I mean, I think we just ought to kind of talk and see where we are with the topics that we need to tackle.
Yeah, I think that we from that meeting, I think they wanted us to take on youth diversion. At least was my perception.
Yes, yes, that was the action item from the last board meeting.
From that last board meeting. So, Crystal, do you remember exactly what people were saying? Is it just like the perception that it's there, or is it I don't know how the topic came up and that it erupted into needing to be an action item for us.
I think it's looking at ways to prevent diversion. But
was there anything presented at the meeting that like had any kind of data or statistics that anyone's actually seeing diversion or an increase in diversion since the medical program came out?
No,
I think more of a speculation.
I think it's speculation. And I think there was I know there's been a lot of talk in both the work groups and in the full board meetings about, youth getting a hold of these products. But I think a lot of that had to do with the Delta 8 and, the hemp derived Delta products that were pretty widely available, and you could get them at the gas station. They're not regulated, pretty easy to get your hands on. And a lot of that, I think, will have been, of course, it's all just going into effect, but with the Industrial Hemp Development Act that Senator Stewart pushed through, basically set up the regulatory parameters surrounding all of those hemp-derived cannabinoid products. So I think a lot of the issue that, I know it was big for Dr. Husted. He's mentioned more than a few times about seeing kids in the emergency room that have got their hands on THC products. From what I'm hearing, and just from what I've seen, I think a lot of that is all circled around the Delta products. And now that the Industrial Hemp Development Act has passed, you're going to have to be 21 to buy them. They've got similar packaging restrictions that the medical cannabis products have. It's going to all have to be clearly labeled and all that. So I think, as far as the topic of diversion, I think that it would make sense to see exactly how it plays out now that now that those parameters on the Delta industry have been worked out. Because I'm not sure, just from the patients that I talk to, I don't know any patient that's going in and buying medical cannabis products and trying to get rid of them. You know what I mean? Like, it's most of the people, and of course I talk with a lot of cancer patients and a lot of really sick people who are just trying to get access to their medicine. So I'm not sure that diversion is really that big of an issue with the medical program. So I don't know. To me, it just makes more sense to really dive into this once we see, how things shift as a result of the legislation that was passed last session. But I mean, that's just kind of what I'm thinking.
I think it's important for us to be proactive because since we don't know the concentrations of THC in any of these products, and we clearly know that higher content of THC leads to some of these catastrophic events in teens like psychosis, that we should be on the front end of this rather than on the back end. So while I agree that we don't exactly know if this has occurred yet, I think by the time we find out it's occurred, we may have lost several kids.
Does anyone have any thoughts? I mean, or are we hearing anything from industry that they're seeing these things happen? I mean, it seems like there was a lot of safeguards put in initially into the legislation and ultimately into what was rolled out when they opened. So I kind of wonder, I mean, I fully hear what you're saying and agree that if there's anything that we as an advisory board can do to give advice to the legislature or the administration that would help protect children, we should. I'll tell you, I'm a member of the Juvenile Justice Commission, which is a West Virginia Supreme Court group, and there's a number of circuit judges on it. And just to kind of follow up on what Rusty was saying, those judges, and then some of this is anecdotal, but at several of our board meetings have brought up that they were seeing a lot of juveniles that were on juvenile probation that were using Delta 8, and they've had a big problem with the Delta 8. I mean, that's something that they've expressed to our group. The judges on the front lines that are seeing kids in the system anyway are having those issues. But I mean, I know I'm open, and I'm sure we probably all are to any suggestions that this group might have as to what we could try to issue some kind of advice to the legislature on as an advisory board. But I do kind of wonder, if we have anything from law enforcement or juvenile officials or even medically, if we've got any data that's showing that that these kids are getting products diverted through the medical cannabis program.
Well,
Right now,
those would be all good recommendations for us to bring to the committee of the whole. And so maybe just to recommend gathering data in order to be proactive, because I can tell you that as soon as Delta 8 is clamped down on, these individuals are going to look elsewhere for a product, not necessarily medical marijuana, but any product that gets them the same effect. And Joe, you can correct me if I'm wrong here. I know I'm out of order, but the other thing, I think if you paid attention to the news, within the last month or so, the ATF has made a statement that anyone who uses marijuana can't own a firearm. And while I don't propose any action, I think the individuals that buy this should be aware of the fact that at the federal level anyway, that being on any marijuana product and owning a firearm are mutually exclusive.
Well, and I think that, it's important to note to that that's always been the case. The thing is, with what was referred to as the Rohrabacher-Farr Amendment, I'm not sure exactly what the amendment is called now, but it gets added to the omnibus spending bill every year since 2014. It prevents the DOJ from allocating any resources whatsoever to actually enforce federal firearm policies on medical cannabis patients or on consumers in legal states. So as long as that remains in the spending bill, they do not have a mechanism to enforce that policy, although that is the federal law. The federal law says if you use medical cannabis, you can't have a gun. That's exactly why I was against adding the medical cannabis patient information into the CSAP, because that does not fall under DOJ jurisdiction. That's DEA jurisdiction. And by doing that, that will absolutely put medical cannabis patients' Second Amendment rights in jeopardy. And thankfully, after multiple conversations with the legislature, they agree. And, that bill wasn't going to go anywhere. But as far as diversion goes, I'm probably, well, I would say I probably am the only person on this board that is a cannabis consumer. If I were to go to the illegal market and get a vape cartridge, you can pick them up anywhere from $20, $25, but you walk into a medical cannabis dispensary and get the same quantity you're definitely going to get better quality because it's regulated. But that product is about 4 times the cost that it is on the street. So from a financial angle, nobody's going to go into a medical cannabis dispensary and buy product to divert, because I mean, you're financially screwing yourself. So, I think that's an important part of this conversation. Again, I'm probably the only person on this board that is a medical cannabis patient and a consumer. I think a lot of the stuff, a lot of the worries, and again, we will have to wait until the data rolls in, but I think a lot of the worries about kids getting a hold of these products, you're going to see a lot of that go down, once law enforcement really starts to enforce the Industrial Hemp Development Act. Because right now, I mean, before that was passed, a high school kid, 18 years old, could stop in a gas station and pick up unregulated Delta products, and those products are garbage. They should never be on the market, period. But I just think as far as a board, when the legislature passed the Medical Cannabis Act, they went to ridiculous lengths to make sure that it was the most restricted program in the country. So as far as, what we can do as an advisory board to guide the legislature to, implement parameters to, keep diversion from happening, I don't know what we could do that they didn't already do. I mean, hell, we've got the OMC that's going into dispensaries right now and pulling flavored vape, flavored tinctures off the shelves because they think that could be enticing to kids. I mean, patients are already having to jump through an enormous amount of hoops just to get the medicine they need. And I mean, I don't know how much more restricted we could make it and still have a workable program. I mean, we could have one on paper, but.
Well, it sounds like we have sort of, I don't know if it's a motion or just a recommendation, but I guess the idea would be to maybe recommend to the full board that we try to proactively gather data about diversion. The issue is going to be, how do we do that? I mean, do we ask the state police? Is there another law enforcement agency that would be better for us to reach out to? As far as medical groups go, I don't know. I mean, it's all going to be protected patient information. I don't know how we'd get that, but if there's medical people here on the board on this subcommittee, and maybe they have better ideas than I would for that. But I mean, I think anything we can do to try to make sure that we're as proactive as possible to protect children would make sense. Jumping around a little bit, just back to the firearm issue. Obviously that's been an issue since before the Medical Cannabis Act went into effect. I'll tell you as an attorney, I mean, and I used to do a lot of criminal defense. The statute actually provides for, if you're a habitual user of a controlled substance, you cannot possess a firearm. And that was that was part of the delay in getting some of the fixes done, I think, to the Medical Cannabis Act originally, is we had a U.S. attorney that was aggressively making statements that they were going to enforce those laws. To Rusty's point, there's not funding for that. There's DOJ precedent not to do that, but certainly, the law is clear that if you're a habitual user of a controlled substance, which this still is federally, then you can't have a firearm. And so that's a serious impact on people's Second Amendment rights. And I don't know that there's something that we can do on that front, but I mean, if that's something that this subcommittee wants to take up, we can. But I guess back to kind of the first thing with this diversion, is there a motion that we recommend to the full board that the board try to gather data from some sources as to diversion?
Yeah, I'll move that.
I'll second.
All right. All those in favor?
Aye.
Aye.
Anybody opposed?
I'm not opposed, but I do think there needs to be a timeline established. Like I say, everything as far as, the youth rates, the numbers are going to be skewed dramatically from, before there was any kind of regulation to after. So I'm not sure what the timeline on collecting that data is. But real quickly, to your point on, is there something this board could do around the firearm issue, and I think there is. The reason that medical cannabis patients can't, under the eyes of the federal government, own or buy new firearms is because it remains a Schedule I substance on the Federal Controlled Substance Act. Schedule I substances, by definition, have no medical value. Okay, we have a medical cannabis program here in the state. The state legislature has already agreed that yes, cannabis is medical. There's no reason it should be on Schedule I. So as a body, as you know, we are put together to guide the legislature and to guide our lawmakers into writing the best policy surrounding medical cannabis. I think it would be prudent for us as a board to draft something that would go to our congressional delegation, urging them to remove cannabis from the Schedule I status because it runs contrary to the existence of a medical cannabis program. So I do think there's something that we can do proactively to protect medical cannabis patients' firearm Second Amendment rights.
I wasn't proposing any action. I just thought it would be reasonable for anyone who's using this and think that this is using it for medical purposes may not understand this. They don't have to necessarily act, but I think like anything else, they have the right to know where they stand. And I understand many of them will already know that, but I'm afraid that, not to be flippant, but some little old lady with back pain who decides to try this and happens to have a pistol in her purse, I just think it wouldn't hurt for them to really understand that. And also understand the points you brought up, Rusty, that it's highly unlikely that this would be prosecuted.
Oh, I agree. I hear from patients all the time, and that is the number one thing. It doesn't matter if they're going through cancer, MS. I've heard from AIDS patients. It doesn't matter what they're going through. The number one question they have is surrounding the Second Amendment. So, I do think that maybe that's something we can put on the table for a discussion for this full board, because it does make sense that we as as an advisory body would recommend to our congressional delegation, or at least make a statement, if not a recommendation, that, allowing cannabis to remain on Schedule I status, that absolutely runs contrary to the existence of a medical cannabis program. And I think that's something that, I don't know how much weight our voices would have, but, you definitely know I'm the one that's going to say it regardless. And I'm the one that's going to keep yelling. And I think that, we could end up at least getting their attention on the issue.
I mean, maybe if we didn't do a full recommendation to the congressional delegation to take it off, maybe even just some kind of recommendation that the congressional delegation look at and consider what to do with cannabis as a whole, given the implications on the Second Amendment rights and the concerns that we have for West Virginia citizens. I mean, maybe we could do something that's not as aggressive as asking them to take it off of Schedule I, but at least asking them to look at it and try to determine how to best protect West Virginia citizens' Second Amendment rights that might be taking part in these types of programs. One thing I want to say, just before I leave that, a number of us, Rusty and Joe and I have been on this board, I think, since the beginning. We talked about some recommendations of maybe taking a position with respect to Schedule I and whether cannabis should be there very early on. I think it was back when Dr. Gupta was still with us. And one of the concerns that was raised then, and I don't know that we ever gotten a clear answer on it, is that if West Virginia changed their own classifications, would that impact any kind of federal funding to DHHR? And so that's something else that probably needs to be looked at, and just make sure we all kind of understand what that would mean. Not that, I mean, we're not taking an action to remove it anyway, but I know that was a concern when we started down this road a while back. And I'm always nervous that we start taking positions that somehow affect dollars coming in for programs that are needed. So, sorry, I think somebody was going to say something and I kind of jumped in.
No, I was just gonna say, bringing this back to the whole board, I think it would then be referred to the medical subcommittee. But I believe it would be helpful to get your take on that, we look for some clarification or something like that, because you're right. Everyone in West Virginia owns at least one gun, probably way more than that. I know I do. And I think there probably are a few people who don't have an idea that it's not technically legal.
So do we want to suggest something to the full board that that we at least discuss the impact of medical cannabis cards and access on West Virginian Second Amendment rights? I mean, I don't know if it wants to be that broad or how everybody's envisioning this, but it sounds like we kind of want to get the full board looking at it so the other subcommittees can look at it too.
I definitely think it makes sense to put it on the board, on the radar of the full board. I will say that there's a lot of support within the legislature, because I've been working with senators and delegates for years on medical cannabis issues, and we've talked a lot over the last few years about this very thing. And they've kind of taken a deep dive into it and come to the conclusion that there isn't really anything that we could do on the state level, because ultimately federal law is going to trump what we do here. But they are all in strong support. And when I say all, I don't know of any delegates or senators that I've spoken with. I'm not trying to throw every single one of our elected officials in the same bucket, but for the ones that I've had conversations with pertaining to this issue, they're in favor of a resolution basically that would say, something along the lines of, in West Virginia, if you're a medical cannabis patient, your Second Amendment rights are safe. Of course, as well as I do, resolutions like that are nothing more than theater. There's no teeth, and there's nothing that, there's nothing that could stop any kind of action being taken. So to me, it would absolutely make sense. You know how I feel. I think that we should recommend that our congressional delegation follow the federal government's recommendation from 1972 and deschedule and declassify cannabis. But
well, let me ask this. I don't know whether with this board, I mean, I think our duties are to make reports and recommendations to the legislature and the governor. I don't know whether as an advisory board, I mean, I guess we'd have to look at the code section that created us again. I don't know whether making some kind of statement, resolution, or recommendation to the congressional delegation is contemplated. I don't know that it's something we can't do. I'm just raising that because I hadn't thought about whether that's something we can even really do under the way we're created, but maybe we could make some kind of recommendation to the governor.
But to that,
the news may soon be part of the congressional delegation.
True. Well, but to that point, I'm pretty sure if that's the case, then none of these conversations we're having, whether we're talking about reciprocity, any of that stuff, are relevant, because I'm pretty sure that in statute, the charges that we were tasked with was looking at vertical integration and the list of conditions, adding and expand or removing conditions, and the banking issue. Like, those were the only three charges that were outlined in statute. So, I think that's probably, if you're a lawyer, your opinion would trump mine for sure, but I'm pretty sure that could be left to interpretation.
Well, I think we probably just need to look at it, but it sounds like, at least from the subcommittee, I mean, what we'd be talking about doing is some kind of recommendation to the full board that the Second Amendment rights of patients be considered and looked at by the full board, and whether there's some other action that the board as a whole could take to make a recommendation to the legislature, governor, or potentially the congressional delegation. But at the
can I make a comment?
Go ahead, Joe. Yeah.
Yeah. I'm not comfortable. I mean, I may be outvoted on this, but I'm not comfortable with changing that regulation, because what we're seeing is increased violence across the country with youth and with others. There is studies that are going on now, and I think until we have enough science to demonstrate that 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 these studies are valid. I mean, there are studies about the increased rate of violence in the states like Colorado and California with cannabis among cannabis users, and I mean, I think that needs to be taken into consideration here. So I wouldn't vote for it. I mean, if this committee decides that they want to bring it to the whole group, that's up to the committee. But I think we need to take a look at it. I think the whole issue of the violence connected.
I'd have to see your data. Actually, I was just, and I can send it out to the members of this board. I'll send it out after the meeting. I just read a study that showed that domestic violence and violent crime is down in Colorado. So I'd have to see your information and your data there, because I mean, I stay on top of this stuff, and that's not anything that I've seen. I've not seen one report that said that attributes increased violence with cannabis use. I'd have to see it.
Either way, I think, hold on just one second, Joe. I think maybe I want to make sure I was clear in what I'm talking about. And I know Rusty had kind of initially talked about maybe making some specific recommendation to the congressional delegation. What I was suggesting a minute ago is that we just recommend to the board as a whole that the interplay of the Cannabis Act and the Second Amendment rights be looked at. And it may well be that the board as a whole or the medical subcommittee looks at this and has your position on it, Joe, that we aren't comfortable asking that anything be changed or that it be declassified. I mean, I think from my perspective, I was just thinking that we take it to the board and see if the board as a whole wants to address the Second Amendment interplay, not necessarily coming out and saying that that we as an advisory board are going to make a recommendation that be removed from the Schedule 1 status, or that there be some other workaround for Second Amendment rights somehow.
I don't think it needs to be in the form of a motion either. I think it just can be a point of information request, that something that maybe that the committee of the whole should have in the back of their minds.
Yeah, I mean, I think we could just take it to the full board that way. I mean, maybe it's nothing specific. It's just that we're going to, inform the board that we've had the discussion and are aware of the issues with the Second Amendment rights, and see whether the board or the other subcommittees want to evaluate that, and then potentially we take some kind of stance on it.
Yeah, that makes sense to me.
Joe?
Yeah, if you guys want to bring it up at the main meeting, yeah, I mean, I'm not opposed to people bringing that up for discussion.
Yeah, I think that's all we were getting at this point with it. It looks like Crystal shared our duties here from the statute, and they are a little broader than just those issues, Rusty, that you mentioned. I think that was initially because those were the things that needed to be evaluated, the banking fix and the others. But it looks like, I mean, if you look at 1 and 2 there, we've got some pretty broad ability to examine laws here and nationally and in other states, and regulatory law as well as statutory law, and analyze it and then make recommendations.
Yep. Thanks for putting that up too.
One other thing with this whole diversion question or issue is, do we have a handle on how many minors are actually approved? Have we looked at that? How is that working with minors getting access through a guardian or a parent? Do we have any numbers on that? And the types of conditions?
We can
Pardon?
have those numbers. I don't have them off the top of my head, but I can look it up. I know when we've looked before, there were not many at all. But I haven't looked at those recently, but I will and let you know.
Okay.
Yeah, if you can get those numbers, Crystal, maybe just share them with, at least with our group, whatever those numbers are. Of course, that wouldn't be diversion, but I see your point, Joe. I mean, it's going to have an interplay
It
with.
just sort of fits, yeah.
There'll be
Well, I
an
mean,
interplay.
and I think what I heard people either saying or inferring or thinking or anecdotally hearing was that these dispensary products are being diverted. I mean, and so like I'm like, I don't think we have it. I don't know, you know, that they're potentially being diverted to youth. I think that's kind of where it came from, a sentiment, a sense, and maybe some, you know, anecdotal stories or reports that people might hear in their local communities. I don't, you know, but that seemed to be me to be where it came from. How true it is, I have no idea, but
Yeah, and to Rusty's point, the cost is almost prohibitive when you get into the diversion of it, because I mean the anecdotes that I hear from patients and then the stuff we've seen nationally and what we've read, it kind of indicates that the medical program is considerably more expensive than other things, other ways to get a hold of cannabis or marijuana, on the street somehow, which is extremely dangerous, because then they're talking about street drugs. But it does seem like with the cost, it wouldn't make a lot of sense economically. But we need some data. I mean, we don't.
I think there are products though that are high concentrates that you can get at the dispensary that you may or may not know what you're getting from a dealer.
Yeah, but that's the thing.
I mean,
If you buy the concentrates from the dispensary, you're going to pay at least 4 times more than you will if you get that same quantity, same product from the street. I mean, it's just the reality of the situation. And I do think, again, we also have to take into account that in high schools, like if high school kids want weed, I guarantee you there's more of a variety as far as products available to high school kids in one hallway than there are varieties of chips at the grocery store. I'm telling you, it's like kids don't have to get, they don't have to find somebody with a medical cannabis card, to get them their weed. It's everywhere. It is absolutely everywhere. And I don't think that there's anything we can do, as far as this board goes, or this body. I don't know what we could do about that other than recommending that they end the nonsense prohibition on cannabis and actually regulate it, because that's the only thing that's really going to keep it out of kids' hands. They're not setting up illegal moonshine stills in the back of the high schools. That's not the way it works, and I think that, again, just from a financial aspect, I know patients that got their card can't afford to buy products in the dispensary, but they have their card and they're still buying their cannabis off the illegal market, because that's the only way they can afford to access it. So, I'm not sure what we can do to stop teenagers getting a hold of cannabis when it is literally everywhere.
I did run the report. I'm sorry. I did run the report real quick, and we have 33 minor patients right now with 4 pending applications.
Is there anything that any age ranges?
I can sort that.
I'm just interested to know what the youngest.
I am too, because a huge number of the patients that I hear from are senior citizens. I mean,
age 7 is the youngest.
7?
Yes. And that is a patient that is, the diagnosis is epilepsy and intractable seizures.
And that's actually one of the indications that it has real evidence behind it. In some of these kids that have terrible recurrent seizures, that this does help.
So we've got 33 minors in the state that have
Okay.
medical cards. So, I mean, it seems like it's probably going to be difficult to get data that's going to show us what's being diverted from the medical cannabis program. But I guess to the extent we can try, we could reach out to the state police. I'm trying to think of other law enforcement groups, maybe juvenile probation offices. I mean, here again, it's probably going to be somewhat anecdotal there because, I mean, you're going to have somehow, the kid tested positive or was found to be using or something. And then ultimately there's a record or something supporting that they got it from somebody in the medical cannabis program. I mean, it seems it's going to be difficult to get the data, but I think, I mean, based on the recommendation that we've adopted here, we'll take it to the full board and suggest that we try to study it and try to get some data on exactly what's happening. Does anybody have any other thoughts or avenues where we might get the
I
data?
think that I don't. I'm like,
I think it makes sense.
so going back, can we switch gears just a little bit
Sure.
to like originally before Matt Christensen, or like before Jason moved out, Crystal came in, and then Matt Christensen took over the helm of public health. We had a plan from our December meeting that we were going to talk about impairment in February, reciprocity in March, and effects on healthcare facilities in April. And so we waited to basically meet because we were wanting to go ahead and have another meeting with Matt Christensen so he could establish the course of where he wants to go with us. And I think that's when the diversion issue came up at that last regular meeting. To me, I don't want to get stuck in the mud ourselves, because I hear all kinds of anxiety over employers and driving under the influence, and certain sectors of help us figure out how what impairment means, rather than just like people are losing their jobs, and I'm not, how I am. I'm pretty conservative about all this, but yeah, I think we do need to figure out, like, where is there a way that you can put together some sense, at least, to start making some sense on impairment. And then I know Rusty wanted to talk again about reciprocity. And of course, health facilities are still out there waiting. We haven't really made a move on making any recommendations in that arena. So we don't have time to do all that tonight. But the plan was that we were going to get some people that were give us some different perspectives, and then tackle these items one by one.
Well, I mean, yeah, I think that was the plan, and then we kind of ended up with some shifting and moving with the office and the board. So we're back to where we need to put those things back up. So I mean, I guess it would make sense to for our next meeting to deal with impairment. And then, I mean, just like we'd already planned, let's just plan out 3 meetings, one for impairment, one for reciprocity, and one for the impacts on healthcare facilities. Unless anyone has any opposition to that, I think we could just say, okay, we're going to do our next meeting will be on impairment. And I don't know if we want to try to organize some speakers again, or we just want to hash it out amongst ourselves and make some recommendations, I'm open either way.
I mean, I think that makes sense to order the meetings in that, to go back to the original plan. Like, it makes sense to me. As far as speakers go, I'm not sure.
Yeah,
Because
we had a recommendation from, I don't know if I can, I'll sure I can find it. I don't know if I can find it quickly enough, from several months ago, of a woman from, I think from Illinois, where they have a pretty prolific, and that, I mean, so, and that's going to be one perspective. Then we got to look at other perspectives. But I could go back, review my notes and find that and see if I can make contact. But then I think you want Rusty to find somebody at your end to, also be a person that could speak to that issue. That makes sense?
Yeah, I would also, especially concerning the impairment conversation, I would like to bring in, I think we need to hear from some patients who are, actively using, because I think impairment, I have some pause with us even taking up the issue of trying to define impairment, because I don't think it's something that can be, not just, I don't think it can be easily done. I'm not sure that it can be done with cannabis. You take someone just like was mentioned earlier, that is experiencing hundreds of seizures a week, and then they use cannabis and they don't have those seizures anymore. Are they impaired because they used cannabis, or are they, better off navigating the world because they use cannabis? You take someone with Parkinson's who, has really violent tremors, and, they use medical cannabis, and within less than a minute, 45 seconds to a minute, they don't have tremors anymore. Are they impaired because they use cannabis, or are they better off to navigate the world? So I think that the definition of impairment, I'm not sure that we can really pinpoint it in the manner that I think some folks want to pinpoint it. I'm definitely open to having the conversation and hearing all perspectives, but I think that for that particular conversation, it's critical that we talk to not just patients who are using it, for pain, but we need to talk with some patients who are using to deal with symptoms, like they deal with from Parkinson's and epilepsy and things like that. Because I feel like with the issue of impairment, we can get way off into the weeds, and we're never really going to, establish a baseline. But I mean, I'm willing to have the conversations for sure. But I think that that's something that we're going to need, not just somebody that feels this way and this, like a for and against type situation. We need to hear from multiple perspectives to even get in the ballpark of understanding cannabis impairment.
I have a close friend who is in recovery, who's on medical cannabis and is using it successfully. And he could probably give some pretty interesting perspectives. He doesn't hide the fact from the fellowship, the recovery community, and he's highly respected. But he's probably could give a pretty good perspective about what, how this has worked for him, and when he feels impaired, when he doesn't feel impaired. Or I mean, it just, but you're right, Rusty. I mean, you got to talk to somebody who's experiencing it right now, and I bet I could get him for one. And then there's a
Cool. Yeah,
woman,
and I can reach out.
yeah, from Illinois. Her name was Jennifer Cifaldi, Cifaldi, and I have her Gmail, and I could reach out to her. I don't know what I'm going to find out, but I mean, I can at least ask. Sound like a plan for the next time we meet?
Yeah, I
Sounds like a
kind of agree with Rusty that defining impairment in this situation is going to be very difficult because there's no evidence like there is with alcohol that at a certain alcohol level, you can prove impairment by putting these people in a driving simulator, and that data is just not there yet. I can tell you for certain how Ruby Hospital handled it, and that is if you don't exhibit behaviors of impairment, then you're not impaired. And so, you know, they wanted to be as broad as they could be. They wanted to make sure that those individuals who may have a medical card were able to use their medication while still protecting patients. And so that was the decision, and that was formalized in policy. And I can say that because I was there for that.
Yeah, and
Yeah.
to your point, Dr. Beckley, right after the legislature passed the Medical Cannabis Act, I flew out to Colorado with a former delegate from Mon County just to do some research and see what, you know, patients, what law enforcement, I mean, we wanted to talk to everybody. And I had a very eye-opening conversation with a law enforcement officer. You know, he'd served for more than 30 years, and we were talking about different you know, things that we had heard, different mechanisms that could determine THC levels in the body and all that, mouth swabs and all of these things. And he just kind of rolled his eyes when we were talking about it. And he said, if you can pass a field sobriety test, then you can drive a car. He said, I don't care if you're on pills, if you're on cocaine, if you're smoking weed, if you've drank too much. He's like, if you're impaired and I sense impairment when I pull you over, I'm going to administer a field sobriety test. He said, and you know, if you're not impaired, you'll pass it. And it was such and his outlook on it was so simple. You know, he was like, I don't know why we're trying to reinvent the wheel for what is arguably the safest of all the substances that people use. So I'm not sure how we get into the conversation, but I'm more than willing to reach out to patients. You know, I'll do everything I can to bring in as many different perspectives as we can find. But yeah, I mean, what's the timeline for this next meeting? Like, when are we doing it next month? Are we waiting, you know, and doing it the month after? Like, what do you guys want to do? Because I just need to know how quickly I need to start reaching out to these patients.
Well, I would think when's the board meeting?
22nd.
The 22nd.
What if we scheduled it for August?
That works for me.
Yeah, that works.
As long as it's not the first week or the 5th through the 12th. I'm wondering what manufacturers or other industry think about this, because this has to be a huge problem for them. If they have strict no usage policies and in the face of a legitimate medical card, that has to be just a tough row to hoe.
Yeah, I mean, you know, it may be worth having someone with an HR background. I know at one point we had talked about, you know, I know some attorneys that advise companies on employment issues, and I know this has been lectured at a lot of CLE seminars and things on that. You know, with that, from that perspective, I'm happy to talk to one of them and see if maybe they would talk to us. And give us, you know, what they're seeing across kind of the board of industries. And I know, you know, we say impairment, I mean, it's broader than that. It's, you know, we have the industry issues, employment issues, and then you also obviously have operating motor vehicle or a boat or whatever it might be. And we've had law enforcement talk to us before. I mean, it's a different, you know, different states have done different things in terms of blood tests for cannabis. Of course, the problem there is if you're a habitual user of it, it builds up over time in your system. And so the blood test isn't really as effective as it might be. To Rusty's point on the field sobriety, the original field sobriety tests were only really done, the studies were all done to show that they could determine alcohol's effects on people. There's specialized tests for controlled substances such as cannabis. And not every officer is trained on those. And so we've had a state trooper talk to us about in the past about that. So I don't know how many, I don't know how many speakers we want to line up for this, but maybe let's go ahead and get the meeting scheduled. And then, you know, to the extent anyone has a speaker they want to bring, let's just kind of shoot that around everybody, and we'll try to put an agenda together with a few speakers for us so we can decide if we want to take an action and take something to the full board.
That makes sense.
All right, what, so you said the first week of August was bad. Let me look here on my end.
Yeah, 5th through the 12th.
What about, what's today, Thursday? What about the 17th?
That'd be fine with me. August 17th at 5:30.
Yeah, I'm good with that.
I'm good.
Okay. All right. Let's make that our next meeting, and we'll focus on impairment. And then the following meeting, we'll focus on the reciprocity issue. And then the third meeting, we'll focus on impact on healthcare facilities. And we'll set the next meeting date at the August.
Yeah.
That works.
All right.
Anybody have anything else for tonight?
No, it's a good meeting. We were actually nice to each other tonight. That's
Yeah,
Won't last.
I see a couple people.
let's go. Let's go with that. huh?
Do we have any public on here? Let's take any comments. If anybody wants to make any comments. Is that what you're saying,
Oh,
Rusty?
yeah, I forgot about
Yeah,
that.
yeah. Yeah, I just saw a couple names I didn't that aren't board members. I thought maybe somebody wanted to. Maybe they don't. Maybe they're tired of listening to us.
If anyone wants to comment, please just type your name into the chat box, and we'll give you. I think we usually give like 90 seconds. There's not a lot of people on.
Joe asked for the date for the meeting. It's August
I just
17th.
typed it.
Oh, there you go. Okay.
All right. I don't see anyone asking to comment.
Cool.
All right.
All right.
Well, with comments, I have a motion to adjourn.
Moved.
I'll move. Second.
Anybody opposed? I don't hear it. I hear no opposition. We are adjourned.
Thank
right.
you.
All right.
Safe track.
Thank you, guys.
Thanks.